America is plunging into a fast-worsening and frightening winter bout with COVID-19 that will leave few citizens and communities untouched. But as the highly transmissible Omicron variant roars across the country, the Biden administration is revealing the most tangible signs of a shifting pandemic strategy several weeks in the making. It is preparing a nation exhausted by 2 years of battling the invisible enemy to live more feasibly alongside it. The new strain of a virus that had already killed more than 800,000 Americans is forcing quick government course alterations. President Joe Biden's White House faces a dilemma rooted in increasing evidence that Omicron causes more mild disease than previous variants yet is so contagious that it has the power to cause massive shutdowns in the fundamental mechanics of daily life by swamping hospitals and closing down shops, schools and transportation. Omicron, it appears, is so virulent that there is simply no way the protocols brought in to fight previous variants can remain in place and allow the country to function in any meaningful way. Blizzards of new public health guidance on how long people should isolate after positive tests and when they should get tested risk further confusing a public that has already seen reversals and changes in such information, a downside of the battle against a pathogen that always seems one step ahead of efforts to combat it. But the evolving administration approach is also one that could eventually point to a sustainable path back to something closer to normality for many Americans once the winter surge abates, a future in which COVID-19 will always be in the background and not eradicated. A palpable shift in policy toward the virus and public perceptions of its impact are occurring during a holiday season in which many people, including those who made rigorous efforts to avoid it until now, have been infected or seen loved ones or friends test positive. This new pandemic reality comes as Omicron, which is far more infectious, takes over, although the previous Delta wave still has some regions in its grip. But with the public desperate for deliverance from a crisis that has pounded the nation's psyche for parts of 3 winters, it is looking like economic and societal factors, rather than just epidemiology, are important in shaping the U.S. response to the virus. This trend is most prominent in a decision by the U.S. Centers for Disease Control and Prevention earlier this week to reduce the period of isolation for those with positive COVID-19 tests from 10 to 5 days in most circumstances. It's evident in the determination of national and local leaders to avoid politically unpopular lockdowns and to keep schools open. It's fair to wonder whether Biden's mantra that science alone will dictate policymaking, which encapsulates his symbolic break with former President Donald Trump's negligence on the pandemic, is loosening, though direct comparisons with the ex-president's policy ignore vastly different moments in the pandemic and the vaccines and treatments now available to fight